The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. People are still trickling in here, so we'll give folks just another minute or so to join, and then we'll go ahead and get started. All right, good morning, everyone. Thank you all for joining us for our webinar today, Worker Protection Standards During Wildland Fires, What You Need to Know. Presenting today will be Forensic Analytical's very own Director of Environmental Health Services, Michelle Rosales, who you can see there on your screen, and Director Kristy Thornton, who you can also see on your screen. Michelle has her master's in public health and is a certified industrial hygienist out of our Los Angeles area office. With over 18 years of experience throughout California and the United States, she's managed hundreds of investigations involving a variety of physical and chemical and biological hazards in various community settings. Michelle leads FACTS's wildfire and structure fire practice group and specializes in occupational and environmental exposure assessments, wildfire smoke assessments, and indoor environmental air quality evaluations. Kristy is based out of our San Diego office, has her master's in occupational hygiene, and is a certified occupational hygienist with over 10 years of experience throughout Australia and the United States. Kristy has worked on a wide variety of industrial hygiene projects, including wildfire smoke and evaluating other chemical, physical, and biological hazards. But before I hand it off to Kristy, I'm going to quickly cover a quick component of the webinar platform we're using today, GoToWebinar. Everyone's in listen-only mode, but that doesn't mean you can't communicate with us. If you have any questions throughout the webinar or experiencing any issues, go ahead and put them in our chat or our questions box. And at the very end of our webinar, for about the last 10 or 15 minutes, we'll have a Q&A portion for any questions you have. So please submit those as you get them throughout the presentation. So with that, I will hand it off to Kristy to go ahead and get started.
Great, thanks, Taylor. So I'm Kristy. We are talking about worker protection standards during wildland fires. And for those of you that haven't heard the term wildland, it is being used a little more at the moment. And that really encompasses all wildfires, prescribed fires, so those intentionally set for ecological benefit, and fires occurring in the wildland-urban interface, so where the wildland vegetation and the urban areas meet. So it's really looking at any wildfire in its entirety. Now, our objectives for today's session are really to understand the impact of wildfires on public health, to learn those fundamentals and what's useful in a wildfire preparedness and response and recovery plan, and to gain an understanding on the current state-approved wildfire standards. There are standards for California, Oregon, Washington, and then obviously the federal and the EPA have some guidance and regulations as well. So to give us an overview of wildfire activity, there is some data from 2023, which is reported to the National Interagency Coordination Center. In 2023, there were around 56,000 wildfires that burnt approximately 2.5 million acres. The total number of fires and acres burned were both below the 5 and the 10-year averages, which may be surprising to some people. But as we all know, it doesn't mean we need to be complacent at all. 2021 information breaking down some fires by state. maybe not surprisingly, showed that California had the highest number of fires and the number of acres burnt. Delaware was the lowest, and Hawaii only had one wildfire in 2021. But at this point, I'm sure we're all aware that every state is at risk. If we use Hawaii as that example, satellite information from September 2022 in comparison to August 2023, after that really extensive fire that occurred in August in Maui, really devastated that area, and over 100 people died. So the wildfires are happening everywhere, and they're really having an impact on every state throughout the US, whether it's one wildfire or a significant number. So what we really are looking at is what's in that smoke. And that's a really complicated question, and it's hard to answer. There's been a lot of research and public health professionals looking into what's making up this smoke, what are the public health hazards, and understanding the hazards of the complexities of this smoke. And it is primarily due to wildfire smoke can encompass a huge array of things. It depends on the environment, the fauna that's being burnt, the fire behavior, the weather. All of these can contribute to what's in that smoke. And because of this, workers, both our firefighting workers and then our employees, can be exposed to a huge variety of types and amounts of compounds in the wildfire smoke. And that can also be different depending on one wildfire to the next. You might live in the same location or work in the same office building, and the different exposure between two fires could be quite different depending on what burned in the vicinity. So in general, the composition of smoke really depends on the nature of the source, what's burning, what's fueling it, and the conditions of combustion. Smoke itself is a mixture of solids, liquids, and gases, so it is quite complex, and it really can contain a huge range of things: carbon monoxide, hydrocarbons, the smoke-related particulates, which we're the most concerned about. It can also include things like formaldehyde or volatile organics. They can all be part of what we're talking about when we're looking at wildfire smoke. And a good example of this is the Woolsey fire, which was burnt in LA in 2018. We may have previously looked at wildfires as the vegetation that's burning, but this burnt through a really urban area. It burnt vehicles, homes. The complexity of that wildfire smoke might then include asbestos, a lot of metals, volatiles, maybe compounds that we weren't looking for previously. So just things to consider when we're talking about wildfire smoke. It's not as simple as burnt wood or burnt vegetation. It can also include other compounds that are burning during the process of that fire. So there are a laundry list of chemicals that are present in wildfire smoke, but from a public health perspective, we're really concerned about the airborne particulate matter. So we're looking at the PM 2.5 and the PM10. They're the primary pollutants of concern over a short-term exposure period, which is days to weeks in relation to a wildfire. And that's what the EPA is reporting as their primary concern as well. So it's the one that we really focus on when we're looking at what to control for our workers. Now, particulate matter, for those that aren't as familiar with this, is measured in some different microns. Really large particles greater than 10 microns don't usually reach the lungs. They're the ones that are in the air. They get in your eyes, your nose, and your throat, and you cough them up a lot, and they're quite irritating, but they might not cause a more significant health effect. Whereas particles less than 10 microns, so what we're classifying as the PM10 range, those can get deeper into your lungs. They can affect your lungs, your heart, your blood vessels, and they are more of a concern for us. And then on top of that, we have our smaller particles, so less than 2.5 microns, which is PM 2.5. They're really fine particles, often not even visible to the human eye. and they can reach deep into the lungs and the bloodstream. So the size of the particulate really does matter when we're talking about wildfires. The risk of experiencing symptoms and adverse health effects due to smoke really varies from person to person, and it is hard to quantify. A lot of workers can have individual risk factors such as age, health conditions, that will make them more likely to be susceptible to health effects from wildfire smoke. And the scientific community don't fully understand how long-term repeated exposures or exposures to a significantly higher concentration of wildfire smoke might impact a worker's health. There is still a lot of research to be done in that field. And there's not a lot of research done into how the exposure of all of these different compounds at once can impact your worker's health. But during wildfires, some of the common health effects are obviously to your respiratory tract: coughing, wheezing, trouble breathing, all of those lung breathing type issues. It can also lead to dizziness. If you're an asthmatic, it can exacerbate your asthma. It can also have a cardiovascular risk. And I think one to note is anxiety and grief. You know, the whole situation of a wildfire event can cause some anxiety and grief to your workers. So that's something to consider in your wildfire preparedness plans as well. How are we dealing with, you know, the more personal impacts? Now, if you do have a workforce that has any of the sensitive population in there, they are at a greater risk. That is, people with asthma and respiratory diseases, cardiovascular diseases, an elderly workforce, pregnant women, children, those of a lower socioeconomic status. And if you have a workforce that does any outdoor work or activities, they're obviously at a higher risk. There's less controls available for a workforce that's out in the elements during a wildfire event. And as a lot of you may already know, it's not just about the fire parameter, where the impact is. You can see from this image where the fire occurred and what's defined as the fire perimeter on the Fires Near Me app. But the impact of the smoke may travel as far as areas like Burbank in this map. So it's not just about the direct area of where the fire is. The impact and the wildfire smoke can travel quite a distance. And hopefully that's evident from this, some satellite images that we've got here. You can see the campfire. The fire itself was a little more inland, but the smoke traveled right out to the coast. It was quite thick. It really stuck along that coastal area for a significant period of time. So coastal communities were more impacted by the smoke than the area itself. Whereas the photo of Idaho, you can see that smoke really spread. It went through all of the canyons and gullies between the mountains out in that area. It really spread a huge distance and covered a lot of area. Another really good example of this was the Canadian wildfires, June 2023. They had more than 250 fires nationwide. 7 million hectares were burnt. And that was another country, but yet the US really had a lot of hazardous air quality from that event. You know, the smoke levels in New York were classified as hazardous. There was also a lot of tons of unhealthy air and smoke that were seen as far as Virginia and Indiana. Some of the graphics you can see there show the Statue of Liberty that was, you know, barely visible. And the air quality at the time was classified as, you know, quite hazardous throughout the US. And that wasn't even a fire that was really in our country. So something to be aware of, that this can travel quite far, and it's something to be, you know, even if you are in a city, you probably need a wildfire response plan in the instance that wildfire smoke travels to your area. So in terms of public health, we look at the air quality index, or the AQI. And that's reported by the US EPA. There's an Air Now website and a bunch of other local pollution control districts and air quality management districts will report this on a daily basis. The AQI is based on 5 air pollutants. It looks at ground level ozone, particle pollution, which is also the particulate matter. So that looks at PM10 and PM2.5, carbon monoxide, sulfur dioxide, and nitrogen dioxide. And the higher the number when you're looking at the AQI, the greater the level of air pollution and the greater the health concern to your workforce. So when we're looking at wildfire smoke, our main concern is with the particulate matter. So we want to look at the PM2.5 and the PM10. That's the primary contaminant of concern, and that can travel miles from the fire and impact communities and cities at quite a significant distance, as we saw from the previous slide. So this slide here was from the Camp Fire, which was in California. You can see the significant smoke that was coming through the area. You know, the vision was really altered by the level of smoke, and it also shows a good indicator of what was the air quality. You know, red was an issue; that's hazardous or unhealthy. The darker red is very unhealthy, and the really maroon color is what's classified as hazardous. So that smoke plume traveled a great distance, and a lot of areas, if they logged into the EPA Air Now website, would have seen that they were in a hazardous environment or unhealthy, and they needed to implement controls for their workplace. One note on that is that the EPA has recently updated their air quality index. As of in February, they rolled out their final rule, which is really to align it with public health and the standards that currently exist based around PM2.5 or soot. It's based on health-based rather than some of the previous information that they were using. They opened this for public comment, and that went through the phase, and this is now a final rule and rolled out as of the beginning of May. The EPA Air Now website has also been reflected to show these updated changes. It includes now a level for moderate. It used to just be green for good and then straight to unhealthy, so they have added moderate in there, which is a break point, really just to give us a buffer to start to look at what controls we might need to put in place before we hit that unhealthy for sensitive groups in that orange zone. All of this information is available on the EPA website if you want to have a look at what they have changed, but something to note that they have made some changes and added in some subgroups to their air quality assessment. And the air quality is based on measuring particulate, and that's in micrograms per cubic meter. So they lowered the ratio of numbers that they were looking at as to what was good, moderate, and then unhealthy. They also lowered their hazardous level from 301 down to 225. So this fire season, we might find that we are hitting the unhealthy, the very unhealthy, and the hazardous levels a little sooner than we had seen in previous years. I'm going to hand it over to Michelle now to talk about some of the standards that are in place.
Thank you, Kristy. Can you do the next slide, please? So I'm going to go over some of the current regulatory standards as well as worker safety guidelines that are currently available in the United States. There are currently 3 states that have wildfire standards in place, one being California, which was the first of the 3. Oregon followed, and then Washington. All 3 of them are very similar in nature. However, as you'll see as I go on through the slides of the specific states, they became more stringent. So the California standard is triggered once you get an AQI value of PM2.5 equal to or greater than 151. And where employers should reasonably anticipate that employees could be exposed to wildfire. So as Kristy previously stated, when we're talking about health impact or during a wildfire event, EPA looks at the particulate matter, the PM 2.5. So that is where the states use their criteria for igniting or triggering the standard and when it comes into place. So California has equal to or greater than 151. Oregon has 101. And then when you get to Washington, it's at greater than or equal to 69. So as you see, it becomes a lot more stringent. And just to put into perspective, now that we have these new AQI values, when we put in these specific values into concentrations, because as we know, it's not a true concentration, it's just a value. If you put it into the AQI calculator, 151 is 55.5 micrograms per cubic meter, so it's already small. 101 is 35.5 micrograms per cubic meter, and then when we get to the AQI value of 69, that's 18.7 micrograms per cubic meter. And just to reiterate, it's when the employer anticipates that there's a potential exposure to wildfire smoke, right? So we already know that there's going to be particulate matter in the air, especially when you're in more industrial areas. Sometimes that can be triggered, not related to wildfires, but if there is a wildfire and they believe their employees can be exposed to it, then they look at these AQI values. Next slide, please. So in California, we have the one regulatory standard, which is 5141.1, but California also has guidelines for other aspects of wildfires. So they have the protecting indoor workers from wildfire smoke with building ventilation systems. And this will make more sense when I talk about the actual standard itself. And there's a worker safety and health during the cleanup of wildfires. And then there's a safety and health of workers rebuilding after wildfire. So the one regulatory standard and 3 additional guidelines associated with wildfire and worker safety. Next slide, please. So 5141.1 became effective on February 1st, 2021. And again, it applies when you have an AQI value for PM 2.5 equal to or greater than 151, regardless of other pollutants. So it has to, so if you've ever looked at the air quality now or those air quality index, it will tell you an AQI value, and then it will tell you what is the primary pollutant that is responsible for that value. So it has to be the PM 2.5. And it is, again, where the employers should reasonably anticipate that the employees may be exposed to wildfire smoke. So this applies to most outdoor workplaces, but as we go further, you'll see it does apply to some indoor workspaces as well. So next slide. Those exempt from this standard are wildfires engaged in wildland fire. So they're not associated with, they've got their own specific regulations or requirements in terms of exposure issues, because there's a lot more than just PM 2.5 they have to worry about. Those exempt are those who are in structures with mechanical ventilation systems. So if you are in an indoor building and you have a mechanical ventilation system that is filtering air, you are exempt from the standard. So if it's greater, it's 200, an AQI value of 200 outdoors, and you've got a system running in place, and you have the doors shut and the windows shut, then you are exempt from this. However, if maybe you have a manufacturing facility or a warehouse in which people are working, and the only means of ventilation is through open doors or windows, then therefore you have to be included in this specific standard. Same goes for enclosed vehicles in which air is filtered by a cabin air filter, and also those who are only exposed to this level of PM 2.5 for or greater for a total of 1 hour or less during a shift. So if it's a small short-term exposure that they're saying 1 hour or less during a shift, then you are exempt. Next slide. And then the last but not least, you are exempt if you can demonstrate at your facility that although they show AQI values in the area or a certain number, if you can show with your own direct reading instrument that you do not exceed this AQI value, then you are exempt. And I find this one very important because it's great to have an understanding of how they come up with these AQI values, right? So there are a certain number of air quality sampling equipment set up, let's say, for instance, in California, several of them set up there. They collect the data and then they extrapolate that data from certain locations based on the terrain, what's going on, etc. So although you may see an AQI value of, let's say, 400 when you're looking online, you may go outside and say, wait, no, it looks very clear. The skies are nice. And that's just because, again, there's some level of uncertainty in your specific areas. One good example is when we had the fires in Malibu, the closest monitor from EPA was all the way in Thousand Oaks. So if you're in California and you're in Southern California, you would say, wow, that seems odd, because Thousand Oaks is several miles away, several mountain ranges away. So a lot of the times we would look at that data and it was not reflective at all of what was going on in Malibu, which again is near the coast in a completely different environment. So if you are in an area that probably doesn't have a monitor nearby, this is a very important way to be apprised of the standard and making sure that you're protecting worker safety, whether wildfire smoke is present in the area or not. And as I previously stated, the AQI values do not reflect true concentration. So it's important to, if you're going to be doing your own monitoring, that you understand the different conversions. So the 151 to 200 unhealthy range is a concentration of 55.5 to 125.5 micrograms per cubic meter. So when doing your monitoring, you're gonna have to do the conversions. EPA has a nice little online calculator that you can put values in to help you with that situation. Next slide. So what does the standard require? Well, one, it requires identification of harmful exposure. So again, that wildfire smoke. It requires a communication system, training and instruction, control of these harmful exposures, and respiratory protection requirements. And I'll go into more detail for each one of them. Next slide. So obtaining the identification of harmful exposure. So that's obtaining that PM 2.5 data. That's what they want to identify whether you have the standard is trigger and what you need to do. So you can obtain this PM 2.5 data with the websites that I previously spoke of. So the EPA now, there's a lot of local air quality pollution control districts that have, and air quality management districts that have their own data available, U.S. Forestry. You can do that through the website or direct contact by these entities. So that's one way of obtaining the data. And the second, again, is measuring it yourself at the work site and converting those PM levels to the corresponding AQI values. And there are specific requirements on the type of monitor that you need for if you're going to be doing this on your own to obtain the PM 2.5 data, and that's reflected in Appendix A of the standard. Next slide. Next is communication. So you need to be able to establish and implement a system for communicating wildfire smoke hazards. And you need to inform your employees of these potential hazards. And it needs to be done in languages in a manner that is readily understandable by employees. So if there's individuals or workers who speak different languages, you need to be able to provide this communication system with them and trainings, etc., and in a language that they can understand. You've got to inform them of what the current AQI values are for that PM 2.5. Inform them what are the current exposure controls that you're going to have set in place to try to reduce exposures to those individuals when they are going to be continuing work, if that's what's determined by the employer. And they also need to have the employees understand that they need to inform their employers and give them an understanding that they need to let them know when there is worsening air quality. Maybe the manager or supervisors aren't necessarily at the site or located in an area that would be reflective of the air quality in that space. So the employees themselves have to understand that they need to be communicating when there's worsening of air quality or if they experience any adverse health effects associated with the exposures from the wildfires. In addition, specific training is required, similar to typical hazard communication. So what are the health effects? A lot of the stuff that Kristy previously spoke about in the slides on what are health effects, how to obtain those current AQI values if they can do it themselves, as well as the employer needs to be relaying that information to them. What are the requirements of the standard? Any employer two-way communication system, again, you're not necessarily going to have all parties or entities in one single location. So there's got to be a way to communicate to one another when there are situations that are worsening air quality or adverse health effects. You also need to let them know that they have the right to obtain medical treatment without fear of reprisal. Current exposure controls are going to be put in place, and we can go over all the different forms of exposure controls that can be useful for wildfire smoke. And the importance, limitations of a respirator, right? Because there's going to be some recommended encouragement and mandatory wearing of respirators in this standard. So the individual who will be wearing them or potentially wearing respirators need to understand the importance of them, what they're used for, and what are the limitations of them as well. Next slide. So the control of harmful exposures, right? So we have our famous hierarchy of hazard controls and industrial hygiene. We have the top tier, the elimination. Well, unfortunately, we can't eliminate wildfires. I mean, that would be nice, but we can't. Substitution, nope, can't do that as well. So now we're stuck with the lower ones, the engineering, administrative, and the personal protective equipment. So in terms of engineering controls, if we are outside, obviously that's not going to be something that we can do to reduce exposures. But maybe let's say we're in a warehouse and there is no local ventilation system. So maybe they shut the doors and they add portable air filtration devices to reduce exposures. That may be a form of engineering control. Next, administrative controls, maybe we take them out of the work area. Maybe we say today they're stopping work. They're no longer going to work in the fields, for instance, or outside because we know that there is potential exposures, or maybe we limit exposures to times when there's lower AQI values. And then once you get up to a certain higher level AQI value, you pull them from the workspace. Another form of a control would be the personal protective equipment, and that would be the use of, mainly the use of respiratory protection. And in the next slide, I'll talk about the respiratory protection. Next slide, please. So the standard recommends and encourages the use, and I put that in quotations, encourages the use of respirators. Specifically, they talk about the dust mask, the N95, when you get to this AQI value that is greater than 151, and sorry, that should be pointing the other way, greater than or equal to 151, so when you trigger the standard, but less than 500 AQI value. This is on a voluntary use basis, and you would follow the voluntary use respiratory protection program. However, if you get to a AQI value for PM2.5 greater than 500, it is then required for use. And then you have to have your formal respiratory protection program. And Kristy will be talking about respiratory protection programs later on in the presentation. So again, once you trigger the standard, you need to recommend on a voluntary use basis and have available respiratory protection, the dust mask. But once you get to the greater than 500, it is now required with a formal respiratory protection program. Next slide. So in a nutshell, that was the standard 5141.1 for California. But I also want to go over some of the California guidelines that are available. And this is nice because it kind of goes over, yes, we talk about majority of those outdoor workers and people who are susceptible, but there are other individuals that may be exposed to wildfire itself, and one is the indoor worker. Yes, we have a central HVAC system, but if you've ever been in an area where there's been a wildfire, you can still smell it. You can still be impacted even when you're in a building itself. And again, that's all dependent. Sometimes it's nicer in those buildings because they've got sophisticated, complex HVAC systems, HEPA filters, etc. But there are guidelines out there that help the indoor worker in reducing exposures. And one is the use of air scrubbers. So putting in those portable air scrubbers into the space to continually filter the air even more. Looking at the ventilation system. Are you shutting the outdoor air intake so that nasty outdoor air isn't coming into the system? So you're just returning the air within and filtering it over and over again. And we could talk about increased air filtration in the next slide, but that's, looking at the ventilation system is very important. Making sure the building is maybe positively pressurized versus negatively pressurized is also important. Restricting exits and entries, because again, remember, it's an outdoor source that potentially is coming into a building. So we want to restrict any potential pathways in which that smoke can come in. So making sure that all windows, operable windows, are shut. If there is a facility that has several entries, maybe limiting the entries into only certain locations. Instead of 10 entries, only limited to 2 areas, and then making sure that your additional controls like an air scrubber or sticky mats, increased cleaning, etc., are localized in the areas that we know are more likely to be impacted than other areas of the building. So Kristy stated having a wildfire preparedness plan is really important, just because you don't want to think about this during the actual wildfire event. You want to be prepared. Wildfire preparedness, response and recovery plan. Next slide. And to go in a little bit more detail about indoor air filtration, the California Air Resource Board has advised that most HVAC systems should be able to accommodate a pleated medium efficiency filter with particle removal ratings of 6 to 11. And some may even be able to use filters with ratings of MERV 13 or higher. They recommend that a low pressure HEPA filter, a MERV rating 17 plus, if you are in a building that has occupants with respiratory or health disease conditions, or if the building experiences frequent wildfire episodes. So that's an important thing to think about when you're thinking about what filter to choose from. Remember, the MERV rating is the higher the rating, the higher the level of filtration that is occurring. Again, the portable air filters are also a great short-term option, but if you're not previously owning one or have that prepared, those are probably hard to come by during wildfire events. So again, being prepared to know who to contact or already having purchased them is really important. And then other factors to consider is efficiency and noise. So yeah, some of those large industrial size HEPA air filtration devices can be really loud. So it's important to kind of know where those would be located if you're going to continue occupancy in a building and continue working. Next slide. And the California also has a worker safety and health cleanup guideline that talks about safety issues and health issues when you're cleaning up wildfires debris. It goes over some of the safety issues. There's electrical issues, structural issues, excavation issues, health issues, carbon monoxide, smoke-related particulate, heat illness. Again, as we spoke about earlier in the presentation, wildland fires aren't necessarily just burning organic material anymore. They can be associated with burning of communities and houses and cars. So not only are we worried about the ash being cleaned up and being a potential health issue, we also have to think about asbestos, silica, metals, polynuclear aromatic hydrocarbons, a whole list of different compounds that a worker can be exposed to when doing the cleanup of these areas. Next slide. And it's nice to know that previously that was all they really talked about, but California has now added to the worker safety and health cleanup different sections on levels of PPE that should be worn. So they really never spoke too much about that, just said, protect yourself. But now they go into what respiratory protection during fire cleanup. And they say, again, it's dependent on the situation. What are you cleaning up? Is there a potential asbestos issue? Is there a potential metals issue where you may have dermal exposures? Are there particulate gas and vapors? What are we looking at? So it's highly dependent on the workspace and needs to have maybe a qualitative risk assessment at minimum to identify what was in the burn debris for understanding of what level of respiratory protection will be required. And the same goes for other personal protective equipment that will be worn. You have your typical hard hats and eye protection, etc. But what level of coverall you may need? You definitely want to be covering your arms and your legs and your hands so there's no dermal exposures also associated with the cleanup process. Next slide. And last but not least is a worker safety and health rebuilding. It's pretty vague in this one. It really just kind of talks about and references more of the Cal OSHA guidance for construction employers. So it's kind of telling you what's your typical health and safety issues associated with construction itself. But they do a small reference, but that's about it. So not too detailed, but still kind of there's a whole encompass of wildfires. You have the workers outside, the workers inside, cleanup in terms of workers, and then now the rebuilding after the fact. Next slide. So following California, Oregon also made a standard associated with wildfire smoke and workers. It became effective in July 2022. It states that it used the Cal OSHA wildfire standard as its starting point to help build consistency with neighboring states. So they've kind of talking in the similar languages, but it also wanted to be more protective than California, and it does. So it, as we previously showed, that it says when you get to the AQI value for PM 2.5 of 101 or greater, that's when it triggers the standard versus California's 151. Next slide. So some of the key differences. So I won't go into this full standard because we did a deep dive into the California one, but the key differences from Oregon is that they have exempt in their standard people who work from home, and they have what they call partial exemption for wildland firefighting and associated support, rescue, evacuation, utilities, communications, and medical operations directly involved in or aiding emergency operations or firefighting operations, and work activities less than 15 minutes in an hour for a total duration of less than 1 hour per 24-hour period. So yeah, so they've got a little bit differences in terms of their exemptions, and they've got differences in their use of respiratory protection. So we have it at a California, being we, that again, 151 is when it's voluntarily recommended for use, and then at 500 or greater, it is a requirement. So California still has that AQI value. Oregon has now adjusted their standard to reflect the new values that EPA has put out for the AQI values. So they no longer are really using, the way I read it is they're no longer saying just the AQI value. They're kind of looking at the concentrations themselves and then using the concentration and kind of converting it. So previously they said if you had an AQI value of 251, you had to use the respirator. And then, so that would be a concentration of 200.9, and now a new AQI value of 277. And they said you had to generate a wildfire smoke respiratory protection program. So that's slightly different than a formal program. It's got some of the nuances in it, but not necessarily the full respiratory protection program. And then if you reach a PM 2.5 concentration of 500.4 micrograms per cubic meter, is now a mandatory requirement to wear it. And that would be now considered an AQI value of 849 or greater. So remember, as Kristy stated, you're going to see higher numbers in terms of AQI values at the same concentrations they used to be, or higher AQI values at lower concentrations. Same, right? So if you've got this concentration of 500.4 micrograms or higher, you now have to wear a respirator and be enrolled in the full respiratory protection program. So that was previously an AQI value of 501, and now would be considered an AQI value of 849. Next slide. And interestingly, they also have in the Oregon OSHA standard that if you can't obtain the AQI values, or you can't do monitoring on your own, you can use what's called the 531 visibility index to demonstrate the current air concentration for PM 2.5 and equivalent AQI value. So they have a table here on the right that says, if you can see over 15 miles, that means you probably have an AQI value between 0 and 50. If you can only see about 3 to 5 miles out, that means you're probably starting to trigger that 101 AQI value for the Oregon OSHA standard, and now you've not triggered everything to be put in place. To me, that sounds very complicated because how far does a mile look? But they've got a nice little photos here to kind of show you that. So you see in this far photo on the left, that's someone being able to see about 3 to 5 miles. The one on the far right is less than 1 mile, and that can be considered in the hazardous range or very hazardous range of 301 to 849. To me, this is very subjective. I mean, a lot of stuff is subjective, but very subjective. But we know Oregon may have areas where there is no Wi-Fi or internet access, and maybe they don't have a monitor, some more rural areas. So they have this also in the standard to help implement when it needs to be triggered to get people going in on all the specific requirements of the standard. Next slide. So that's Oregon. It's got, as you saw, a lot more stringent than California. Now, next in line was Washington State, which became effective this year in January, and it's even more stringent than Oregon and California. Next slide. And I'll just go over the key differences as well. It also exempt from those who work from home, but the standard is now triggered when you hit an AQI value of 69 for the PM 2.5. And with that, they require when you hit this AQI value that you generate a wildfire smoke response plan. And that needs to include the health effects and symptoms, importance of informing employers of symptoms, the right to obtain medical attention, requirements of the standards, methods of determining these AQI values, and the importance, limitations, proper use, and maintenance of a respirator. So there's a few more requirements or additions for the wildfire smoke response plan, but those were some of the big ones that I wanted to highlight. It also talks about supervisor training, so having the supervisor understand a lot of the standard, as well as the health effects and how to protect workers. And it also has dust monitoring equipment specifications and maintenance requirements provided in the standard. Next slide. And when we talk about the respirator use, they have the employer encouraging its use when you have the AQI values of 69 to 100. It then states when you get to the 101 to 300, not only do you encourage the use, you need to directly distribute or have sufficient supply available. So 69 to 100, just saying, hey, everyone, you should, we have N95s available and here they are if you want to use them. But once you get to greater than 101 or greater, now you're kind of pushing a little bit harder, directly distributing it and kind of further emphasizing the use of the respirator. And then once you get to 301 to 499, the employer must directly provide the N95s and encourage use at those specific AQI values. And when you get to 500 or greater, they require the mandatory use of the respirators, enrollment in a respiratory protection program, they call out the N95s, and now they're talking about half-face respirators with P100 cartridges, and they use an sign protection factor of 10 or greater noted in there. Washington has put out a comment that they will be amending the standard to reflect the new AQI value changes. They're still using the same AQI numbers at this time, but they will be revising it, and I believe sometime this year they have to do that specifically. So you may see changes in Washington soon as well. California I haven't seen any mention of it when I look at the websites, but I'm sure they'll be changing soon as well. Next slide. And this is a nice one pager if you are a company that has several facilities in California, Oregon, and Washington, that kind of goes over the key differences between the standards, and this was found in the Synergist in March 2024. Next slide. So that's a nice little quick look at the differences. And then, although I talked about those 3 specific state ones, that you're not immune if you're in different states. We have, as always, in industrial hygiene, our general duty clause that says that all workplaces, you need to provide protection from safety hazards created by wildfires. And federal OSHA specifically says that protection from safety hazards created by wildfires, because as an employer, it is your legal obligation to protect workers from hazardous conditions, one being wildfire smoke that can cause death or serious physical injury. So you have to be able to provide them with personal protective equipment and try to reduce exposures to the extent possible. So you are not immune from it because you are not in California, Oregon, or Washington. You have the general duty clause that requires identification, exposure controls, and protection of workers from safety issues. And next is Kristy going over quickly, sorry, I went over some of the respiratory protection requirements.
Yeah, so we just wanted to kind of go over those respiratory protection program requirements. For California, like Michelle mentioned, it is all set out in that Title 8, Section 5144. If it's voluntary use, you are required to provide respirators to your workers or permit them to use their own respirators. You aren't required to have a written respiratory protection program or medically evaluate or fit test your workers if it is just for voluntary use. But you are required to make sure that the respirator that they're using will not create a hazard. In addition to that, there are some appendices that you are required to provide your workforce. Appendix D, which is in that regulation as well. It's quite easily accessible, and Appendix B for California. And you are required to provide your workforce with enough respirators when that AQI value is 151, but does not exceed 500. So there are some requirements on what you need to provide the workers, even though it is a voluntary program. For Oregon, as stated in their standard as well, they use the respiratory protection standard, the 29 CFR, but they do also have that specific wildfire smoke respiratory protection program. And in accordance with that, you need to provide your employees with training. They need to be provided with a filtering facepiece respirator and a user seal check, and the requirements on the storage and replacement and maintenance of those respirators. If the air quality index is above that 841, if it's quite high, you need to provide your employees with a NIOSH approved respirator in accordance with that respiratory protection standard. You can't use the wildfire smoke respiratory protection program if the AQI is above 849 for Oregon. A note, if you are doing the wildfire smoke program, if you're just using the voluntary use, you do not have to provide medical evaluation or fit testing as long as the AQI is below that 501 number currently. And then for Washington, Again, you have to provide your workers voluntarily with respirators at no cost to the employees, and they should be encouraged to use them if the AQI is 101 or above. That's all spelt out in the Washington standard as well. They have an appendix, Appendix B, which is for the training regarding voluntary use of respirators for wildfire smoke. So if you are in that state or have facilities in that state, you can access that appendix for your employees. And when the PM 2.5 is higher, when it's above that 555, they need to be enrolled in a respiratory protection program. Again, the requirements of that are outlined in the standard. If that is the case, your workers need to be fit tested, they need to be medically evaluated, and they must be clean shaven to wear the respirator that's recommended. Like Michelle mentioned, the Washington regulations also talk about full face respirators, half face respirators, P100s. They basically spell out the different respirators that can be used and the requirements for each of those if you are using them. So just to give you a little snapshot of what a respiratory protection program would involve if that was a requirement, it does require a written program. So this is a policy if you're using N95s or above. Workers need to be medically evaluated. So are they fit and able to wear the respirator that you're providing them? Are they fit tested? Do they know how to wear it correctly? Are they trained? Do they understand the storage, the maintenance, what's required of using that respirator? You do have to have some record keeping, so keep track of due dates if you're using filtered cartridges, when they need to be changed, keeping track of your employee training, and evaluating that program. So it's a really cyclical approach that needs to be updated regularly. It's not just a one-off, let's write this program and forget about it. So it's something that if you are in an area of concern, you probably should start looking at that program now and get one written and get it on your books. There are some good resources. The CDC has some firefighting, wildfire smoke link that we have there, which gives you more of an understanding on what OSHA and federally they would recommend for a respirator program. But just something to keep in mind if you are required to develop an official respirator program. Again, if it's voluntary and workers are wearing them just in an occupational setting, you need to follow the requirements for voluntary use, which doesn't require the medical evaluation, but there are certain requirements state by state and also federally just for training the workers and making sure they understand how to use the respirator that they're being given. And respirators, like the N95s, may be one of the easiest controls to implement for limiting your workers' exposure to particulates during a wildfire and a wildland event. In some instances, it might be the only option to protect some of your workers, but just remember that there are these requirements for your wildfire preparedness and response plan. So definitely consider them. Obviously consider alternative controls that Michelle mentioned as well, and solutions where respirators may not be easily available. If there's a large fire event, respirators may be hard to come about. They were during the COVID era as well. So do you have respirators available? Do you have a program in place? Just all of those things to consider as we come into fire season again. That summarizes what we have today. We wanted to kind of open it up to any questions.
Michelle and Kristy, we had several questions come in. We've only got about a minute left, so we'll run through as many as we can, as quickly as we can. The first one, what if your filtered building indoor AQI level eventually builds up and exceeds the AQI 151 level for greater than 1 hour? Would the Cal OSHA reg apply at that point?
That's a great question. It states it doesn't, but I would say once you get to that level, you should be leaving the space, definitely. But regulatory wise, it says if you're exempt, if you're in a building that you have a mechanical system and have closed up the area to the extent possible.
All right. And we'll call this the last question for the day so we don't go over. Where do you find these actual additional California guidelines, i.e. indoor workers, cleanup workers, etc.?
Oh, if you Google California wildfire standards, the first one that comes up will say wildfire smoke emergency standard. And from there, it is a page that gives you several different, oh, actually, I'm wrong. Sorry. Let me do it. Guidelines. I would probably just search up wildfire guidelines.
We can include that link too, Michelle.
I can include that. I know where it is.
Okay.
It's one page that includes the standard, all the different guidelines, lots of different references, EPA, etc., guidance documents for people to look at.
Perfect. We'll include that link. We will send an email tomorrow with a recording of this webinar as well as a copy of the slides if those would be helpful. Thank you, Michelle and Kristy, and everybody who attended for joining us today. Please reach out if you have any follow-up questions. I will send out Michelle and Kristy's information as well. So thank you all and have a great rest of your day.
Thank you.